If a patient is missing a tooth, historically there were only few options available to the patient to replace a missing tooth, like this. The dentist would shave away the top of the tooth on either side, and then a three-piece bridge would be made that would fit over the shaved teeth, thus replacing the missing tooth. That poses several problems because oftentimes the teeth on either side are healthy teeth, and shaving them away is really going away from our idea of do no harm. So with the advent of dental implants, what we're able to do is we're able to place a titanium piece into the area where the tooth is missing. This is a threaded or screw-like piece that goes into the patient's jaw. Obviously this is an enlarged model, and it acts like the root of a tooth. After the dental implant is placed and some time is allowed to heal, the patient would go back to the general dentist, who would then place a tooth that fits into the implant, thus replacing the missing tooth without having to touch or ruin the adjacent teeth. This has been the biggest advancement in dentistry probably in the last 2 decades, and with each year more and more advances are made in the structure and type of dental implants. I've had the experience of placing over 5,000 dental implants, all of which have been successfully restored, so I can predictably do the procedure with minimal trauma, very little postoperative discomfort, and have you back in function very shortly. The downtime for dental implants is really minimal. With techniques I've been able to develop over the last 15 years, the procedure requires for the placement of one dental implant between 15 and 20 minutes. It takes place in the office. Most patients have the procedure done under sedation, which means a light anesthesia. There is very minimal downtime, maybe a day or two of soreness. Of course, depending on how many implants are placed, the soreness or discomfort time may increase slightly. I've had multiple cases where we've placed 9 to 10 implants in each jaw at one time in one visit, and the patient reported maybe a day or two of soreness. So the procedure is very minimally invasive. We use techniques that have been advanced by our dental implant center over the last 15 years that require very small incisions with very little downtime.